Hi, my name is Ajani, and I'm back for another go round, a second episode on Disability Channel.
It's Disability Clinic.
Disability Clinic.
Welcome to Disability Clinic, where healthcare goes to the doctors. I'm your host, Dr. Stephanie Van. Is your relationship status with your doctor complicated? We're going to talk about how special it is and how rare it is to have a good relationship with your doctors. My guest tonight has a lot of experience with doctors, and we're going to dissect the secrets to a good doctor-patient relationship. Please welcome actor, producer, medical geek, and friend of the show, Mr. Ajani A.J. Murray.
Like in a very ironic way, I'm into the medical stuff, but I'm very, it makes me nervous and scared when I'm the patient, especially right now in this particular time. I admire and I'm always lifting up in prayer and positive energy for the first responders and people like you and the whole medical community that's on the line.
Thank you, AJ. I really appreciate that. And I will say that anyone being a patient, especially people in healthcare, everyone is scared and nervous when they have to become a patient themselves. And it's not like will it happen or won't it happen? It's basically a matter of time. At some point, like, everybody needs healthcare. And so it's such a relatable experience that you may not realize it until you find yourself needing it as well. But it just makes sense that even though you're not a physician or in healthcare necessarily, like, you've had to be involved with it for your own health. And I think that's so important. I wish more people recognize that.
I've had 100, sir. I've had 100, but I've been on an operating table 100 times since I was a baby, actually. So I'm used to hospitals like in a way that you shouldn't be. But I'm used to it. Oh, excuse me, I just started saying stuff and rambling on but you had questions you want to ask, and I was like, this is your show, so I'll get back to you.
Yeah, but you're my honored guest. Like, we should talk about whatever we want. I was going to ask you about healthcare because, like you said, you kind of have more experience with it than you'd wish on anyone. It's not fun being at the hospital. It's not fun feeling like you're sick. And I don't, we can get as heavy or as light as you want, but
I'm an open book wherever you want to go. So I love doctors and no medical profession. I've had some incredible doctors. I always give credit to the nurses because doctors, like, they prescribe the medicine to you or give you the surgery. The nurses are like really there in the trenches with you. But I would say, like, just in case you were able to show this episode to new doctors or medical students, like, doctors have to get better at their bedside manner, and they have to get better at really listening to their patient. And you may be the expert, and you are, because we didn't have our nose in boxes or cutting up cadavers or doing like shit for a bunch of hours. But a lot of times it's like, I think you should come together as partners because you may have the language and all the right, proper vernacular, but the patients really know what they're feeling and they know their body. But it would just go a long way not to just seem like you're like the next patient, and you really have to like skedaddle or get out of. So I'm not trying to crap or poo poo on doctors. So sorry, doctors. I really appreciate it because I do love doctors.
No, that is so important for doctors to hear because you're absolutely right. Yes, we're under time constraints. Yes, we're all book smart and we have all the language and all this jargon. But if we're not there to be present and understand what someone is telling us that they need help with, we're not able to do our jobs well. We're not able to apply all the knowledge that we have because we're not focused on the right thing. You might be able to imagine how many people have told me, they've told me they haven't felt listened to, they felt dismissed.
Right.
They felt like the doctor was just trying to, like, get on to the next person. And while that's not entirely any individual physician's fault, it's not like they're trying to be dismissive or rude. There's lots of other systemic issues, but like we need that feedback. Like doctors need to know how they can do better, because the whole point of their jobs is to take care of people. And if people don't feel taken care of, that's a huge problem. So I'm so glad that you brought that up.
It's really good to have a relationship and try to have the same doctor if you're comfortable with the doctor. Because, like, for instance, I had a doctor who was my urologist for like 15 years, and the only reason why he's not now is because he's retired. And so one time I went into the ER. I was in a lot of pain, and I just knew that it was a kidney stone. They took pictures. The emergency room doctor said that they didn't see anything, but my urologist happened to be there, and he said, "You know, AJ, I don't see anything. Like, I don't see like a kidney stone on these pictures, but I trust you." So he booked an OR anyway. And lo and behold, like, I was under, so I wasn't able to see. But lo and behold, I had a sizable kidney stone. And he said the whole OR was clapping because they were like, AJ's right. A lot of the staff knew me. So they were like, AJ's right. Really have been through a lot. I went to this hospital for 15 years. Like, I know like so much of the staff, even to the point where it's like we know each other by first name. I've seen their children grow up. But I always tell this story. I always bring this story up because it's, to me, a great story about good doctor patient rapport and relationship. Because if that was just like a urologist who hadn't seen me before, only seen me a couple times, I would have went home with an obstruction because of my anatomy. It wasn't seen on the X-ray, but because my doctor was my doctor and he trusts me. And one of the things that I miss about, like, my new doctor's incredible. I'm not throwing him under the bus, but one of the things that I miss about my old doctor is he knew my body, but he trusted me as well. I know I told a really long, really long story. Sorry about.
No, no
Um,
worries. You're saying a lot of important things, and it really is frustrating when you've got a very good relationship with the doctor, you know they care about you, you know they trust you. It goes both ways, and then you feel like you kind of have to start all over again. If you need to, it's just kind of a necessity.
it's just a lot of benefits to having a doctor or a team that knows you. And
Absolutely.
I cannot emphasize that enough. Only to say, now I know everybody's not my journey, and the things I described was pretty severe. But even if it's not severe, it's just well worth it investing into, if you can, investing into getting a good primary care doctor. But I don't think that's emphasized enough. Like, having a doctor that you have a relationship with.
It's tough because I agree that it doesn't get emphasized enough. And I think there's a few reasons why. One, everyone just kind of assumes, like, oh, yeah, of course your doctor wants to have a good relationship with you. Of course your doctor cares about you. And then it's so hard to call out doctors when they aren't behaving that way,
Yeah.
because they're very educated, your health is kind of in their hands. Like, people not in medicine, they don't know all the jargon, they don't know what the right decision is. So they're kind of forced to trust their doctor, even if it's not always the closest or most comfortable relationship. I'm assuming no doctor wants to do a bad job. Every doctor wants to care about their patients.
Yeah.
But then, especially primary care doctors, that specialty is so broad. There's so much variability, and there's such a high demand, especially in places where there's a low volume of doctors, like more remote areas. So there are doctors who have a ton of patients that they're responsible for. They may only have 10 or 15 minutes per patient,
Yeah.
in a given day. And
Yes.
like, that's not
Totally.
their fault. It's just kind of the way the system is.
Totally.
Now it's my turn to ramble on for a story. Our conversation is reminding me of a patient I met very recently. Unfortunately, the person came 2 hours late, and it was the end of the day. And my nurses were like, Dr. Van, do you still want to see this patient? And I was like, oh my gosh, I really want to go home. But I figured they came all that way. Like, sure, I'll see them. I don't have 40 minutes. Maybe I have like 30 minutes max with this new person that I'm meeting. And so the person was so nice. I really enjoyed talking with them. I could tell that they had a lot of issues going on, but I had to kind of cut that person off like a few minutes into meeting them and be like, okay, look, like, let's make the most of our time. I want to focus on the top 3 things that are bothering you. And I just kind of tried to focus the visit. I was worried that that person would be offended, or, you know, I don't like cutting people off when they just want to chat with me. But that person really appreciated it. They were like, thank you for not wasting my time. It's a team effort. You have to kind of trust each other. The doctor has to be kind of a guide when it comes to navigating healthcare decisions. But the patient or the person who's coming to the doctor, I always consider them the boss. Like, they're the ones who know what things feel like, who know what's going on the best. So that's my long rambling story about patient and doctor relationship.
Being a doctor, maybe you can answer this for me, because I'm wondering, like, is it a new thing? Or I've encountered some doctors where it's like they're explaining the situation and you're not really the doctor, but then they're like, what do you want to do? And I'm like, I don't know. You're the doctor. Like, I'm not the expert, but and it's like me and my mom are always scratching our heads, like, and I'm like, thank you for empowering me. I recognize that as a good thing, but also you're the one that has the medical degree. I don't. Is it because of, not that I'm trying to be negative, but is it because of they're afraid to be sued, or?
I think the primary reason for that, especially recently, I think it's a positive shift. Historically, you know, your doctor was telling you how it was and what you're supposed to do, and people just had no choice but to blindly trust it. Nowadays, people are a little bit more informed. There's more information out there. They're taking more responsibility for their health. It's a good thing that people aren't like just blindly following what the doctors are telling them. It's still working out some kinks though, because, you know, doctors have to explain things in a way that people can understand them. You can't just be like, there's this complicated procedure and these 5 medications we could try. What do you want to do? They have to kind of help someone navigate the pros and cons.
Yeah, because I've been in a situation like, I don't know, is this a test or?
I'm glad that it's moving away from doctors just telling people what to do. I feel like that's really outdated, and that has generated a lot of mistakes, a lot of bitterness, and it's good that people are being encouraged to take more control over their health.
We come a long way from Little House, or like Dr. Quinn or something like.
Fun fact, Dr. Baker is the friendly doctor character from Little House on the Prairie, which aired from 1974 to 1983. One of his storylines involves him falling in love with a much younger girl who works with him. Bad Dr. Baker.
She is a child, and you are almost as old as me.
I've said that to myself and more, including if we were to marry, have children, they'd be more like my grandchildren.
For the first time in my life, I really feel alive.
I'm just not thinking. I'm spoiling your pleasure. I'm sorry.
Spoiling my pleasure? Dr. Quinn, Medicine Woman, ran from 1993 to 1998. And to quote Wikipedia, she acts as a one-woman mission to convince the townspeople a female doctor can successfully practice medicine.
Well, I'll let you go. I'll go ahead and get off the guy. But if it wasn't up to me, we would have been off like 20 minutes ago. But I keep on talking. Like, I don't know if you want me to work with you or not, because I won't shut the hell up.
Yeah, I changed my mind. Sorry, this is it. To help doctors become better at listening and trusting their patients, give this video a like and subscribe to Disability Clinic. Disability Clinic. Thanks for watching. Is your relationship with your doctor complicated? To help doctors become better at listening